Well, yes, I mean, during the 3 past months, we're talking about tens of hospitals that closed, dozens of health clinics that also were forced to close because of the continuous Israeli attacks on these facilities, adding the fact of the very little aid that is entering Gaza and the lack of medicine, medical supplies. All of these reasons are putting the lives of patients, premature babies, pregnant women at risk. Also adding the fact of the Palestinian women are forced to flee their homes, walking for hours. I mean, from northern Gaza to southern Gaza, we are talking about 4 to 5 hours of walking in the safe passages just so they can arrive to the green areas. So yes, all of these are risks that are adding to the suffering of people and pregnant women in Gaza. And here is a story and where we talked to some of these women.
The health system in Gaza has collapsed. Dozens of hospitals and dozens more healthcare centers have shut down over the past 3 months, exposing the lives of hundreds of wounded people, patients, pregnant women and premature babies at the risk of losing their lives as a result of Israeli bombing. Pregnant women in Gaza are at increased risk. In many cases, they are forced to give birth or have abortions in camps or on the road. This is what happened to Shireen Abu Dahir, who suffered a miscarriage when she was fleeing from the north to the south.
We moved on foot from the north to the checkpoint set up to pass through to the south. The journey was very long and tiring because I was pregnant and had a previous surgery on my foot. But I could not stop because of fear, and I did not pay attention to my bleeding. When I reached the checkpoint, I felt terrified. There were a lot of people tied up and naked. They were arrested.
Dr. Jamal Al-Hams, a specialist in obstetrics and gynecology, attributed the increase in miscarriage rates to the Israeli weapons used during the war on Gaza, including phosphor bombs, smoke bombs, and toxins emitted from the rockets used in the Israeli attacks on the Strip.
We're certain that the weapons used against residents are ammunition that we were not previously accustomed to. They have caused disastrous health impacts, and among them is the increase in miscarriages. We receive women with miscarriages around the clock and constantly see pregnant women bleeding.
Due to limited resources and the severe shortage of medicine, many cesarean sections and deliveries are performed in Gaza without basic medical supplies or anesthesia and without any postnatal care. Women are forced to leave the hospital within hours after giving birth due to the scarcity of available beds and in light of the daily arrival of hundreds of wounded to the hospitals. In addition to increased miscarriages, there has been an increase in postnatal infant mortality due to high infection rates and the lack of basic supplies such as vaccinations, milk, and diapers.